Hey, my name is Kelby Hightower with MedicareHub. We know Medicare is extremely confusing, so we're here to make your life easy by making Medicare simple. In this video, I will cover the following items. What is Medicare Part B? And what does it cost you? What cost amounts do I pay on Medicare Part B? What if I'm still covered by my employer insurance after 65? How do I apply for Part B? Plus, for those who stay to the end, I'll share how this unlocks the door to all your health plan options and eliminates not knowing really the correct steps moving forward if you're turning 65, retiring, or you're 70 and you're just now retiring. You will have a few things to do to prepare for going on to Medicare Part B. Stay tuned as I guide you through how Medicare Part B works and diving into breaking out the different services covered by Medicare Part B. So exactly what is Medicare Part B? So Medicare B breaks into two portions of care that breaks down into the following two types of services. First are the medical necessary services, which are services or supplies that are needed to diagnose or treat your medical condition and that meets accepted standards of medical practices. Basically, your visit to your PCP, specialist, and other services they provide. This is what I shared earlier about the specialist doing a surgery on you. If you're admitted to the hospital, they will bill Medicare and you're responsible for the deductible for that year, and you're also responsible for paying for the 20% of the billable rate. So the cost can be astronomical for those on original Medicare in this situation. Secondly, Medicare Part B covers preventative services, which is health care to prevent illnesses or detected at an early stage, which treatment is most likely to work best. And those can include bone mass measurements, colorectal screenings, immunization and flu shots, pap smear and pelvic examinations and mammograms, and all your well woman physicals, yearly wellness exams, screenings for high-risk seniors with certain diseases, and so much more. You pay nothing for most of these preventative services if you get the services from a healthcare provider who accepts original Medicare. We like to refer to this as continuity of care, the way your doctor or doctors are able to determine a health risk, assess it, and then work with you on resolving, managing it, or eliminating the risk. I would encourage you to be a vital part of your healthcare journey and stay informed on your options along the way. You know, what is retirement without your health and wellness? It's really just a burden. You deserve more than that out of life. So Medicare Part B also covers things like clinical research, like specific office visits and tests, and in certain qualifying clinical research studies. You know, you're in the lab, you basically become a lab rat for opportunities that can help improve the wellness of seniors. Also, it can cover ambulance service, air ambulance, durable medical equipment. That's going to be like oxygen and wheelchairs and things like that, like diabetic shoes that some of you guys may be having to take and use. Mental health services, inpatient psychiatric hospital, outpatient individual and group therapy, partial hospitalization, limited outpatient prescription drug, Part B drugs. So now I'd like to walk you through what are the costs associated with Medicare Part B services. To enroll and have Medicare Part B, you'll have to pay a Medicare Part B premium charged by Medicare monthly. This premium is set as a fixed cost each year, but can increase yearly based on cost of living adjustments, or what we call COLA, that occurs each year. They have recently adjusted the Part B premium from $148.50 up to $203 per month. This is the highest adjustment in years. To find out more about why this happened, I would encourage you guys to watch our video on what caused the Part B premium to increase so much in 2022. What drug is causing the increase, and I can give you a hint, it's pertaining to dementia. So under normal circumstances, you will see small increases in your Part B premium yearly unless you're earning income or is at or above certain levels. For this year, you'll pay $170.10 if your income's at or below $91,000 or less as an individual, Or if you're a joint or married at $182,000 or less, your monthly premium will still be at $170.10. But if your income is at or above the following amount, you'll pay more for your Part B premium. So let's take a moment to cover the income and the cost of these premiums as well. So if your premium will be adjusted to $238.10 if you're an individual with an income of $91,000 to $114,000. It'll be adjusted also for people that are married or joint at $182,000 to $228,000 income. Your premium will go up to $340.20 if you're single at $114,000 to $142,000 income, or if you're married or jointly filing at $228,000 to $284,000. If you have had an adjustment based on a one-time payout during the year, you may qualify to file an appeal with Social Security using the form in our description below to have your Part B adjusted, or give us a call. We can also help you fill out the proper paperwork if you think you need to have an adjustment. We'd love to help you to ensure you do it correctly. The form you will need to fill out and submit is called the SSA-44 form, or referred to as the Medicare Income Related Monthly Adjustment Amount caused by a life-changing event. You may qualify for the adjustment if you've had one of these life-changing events, which are, there's been a marriage, there's been a divorce and an annulment, a death of a spouse, a work stoppage, work reduction, loss of income producing property, a loss of pension income, an employer settlement payment. So my mom had this happen, the employment settlement payment. My mom had a pretty crazy situation happen this last year. She was back paid on a small retirement she could have drawn money starting 20 years ago from a state retirement pension. It was about $75 per month for 33 months of work she did with the correctional facility at a jail. She didn't draw any of the retirement, so when she turned 78, we filed for it. And by that time, she was going to get paid $250 per month. So they reconciled her back $65,000 of unpaid earnings, and that pushed her into a higher income bracket for that year, which adjusted her Part B premium. But since my mom was working still, it pushed her, up into income. But since it was basically a one-time lifetime occurrence, we actually were able to file an appeal for that. Now, the bad news is, because it's a government, if you do file an appeal, be patient because it takes some time. Guys, in our next video, I'll cover the cost you pay when being on just original Medicare Part B. Stay tuned to enjoy a deep dive into your Medicare Part B cost and really understand the risk that you have when just being on or staying on original Medicare, as opposed to choosing other health plan options to go along with your Medicare that can cover those costs for you. Talk to you soon.